Okay, today we're going to be talking about the neck, and there's a lot to it, so I apologize. So this is a CT, and this is post-contrast. You can see that we have arterial and venous, so you can see that this is delayed because we are in the jugular more so than the arteries. So don't let this slide overwhelm you. You do know a lot about it already, so when we're looking at it and we're coming around, so we have the sphenoid sinus and the clivus, you have your pharyngeal tonsil and the opening for your auditory tube, you have your nasopharynx, your soft palate, uvula, palatine tonsil, oropharynx, you have your epiglottis with your laryngopharynx, you have your larynx, your vestibular folds, and your true folds here. So your esophagus is right here, and a lot of the times it's compressed because it's just a muscle, so unless there's air or particles of food in there, you're not going to see it other than a round ball on an axial. Here is your trachea. You have your cricoid cartilage, your thyroid cartilage, your vallecula, linguinal tonsils, your hyoid bone, and you'll see that just free floating there in the soft tissues. Your mandible, your tongue, your oral cavity, your hard palate, your inferior nasal concha, you have your external nares, so when you hear that people have nares, MRSA nares, that's where it's at, it's just at the nasal opening, so please don't pick their nose. You have your middle nasal concha, superior nasal concha, your nasal cartilage, nasal bone, and your frontal sinus. Like I said, you already know a majority of this slide. This is an MRI Sag T1. So if we start at the top, we have your hard palate coming across with your soft palate. Your clivus, you have your nasal pharynx, oral pharynx there. We've got your uvula hanging on the end. Coming down, we have your epiglottis is there. This is your laryngeal pharynx. And you have your laryngeal pharynx coming through here. This is your vallecula. It's a little pocket there, and your tongue. Okay, so looking here at this slide, we have your nasal pharynx and your sphenoid sinus with your clivus, your soft palate hanging down here, your uvula on the end. You have your oral pharynx, your larynx, and your trachea coming down. You can see that your esophagus is collapsed there. Your laryngeal pharynx is here, your epiglottis is up, and you can see a little air bubble there. That's your vallecula. So here's your hyoid bone right there, your oral pharynx, your tongue, and this is your hard palate with your inferior nasal concha and your middle nasal concha. Your ethmoid air cells are just above that. So this is an MRI axial T1. You have your hard palate with your uvula, your nasal pharynx, and your soft palate is located there. This is your hard palate, uvula, and your soft palate right here with your nasal pharynx. You look to see how high we are so you know exactly where we're cutting through. This is MRI axial T1 with your hard palate, and you have your ramus of your mandible. This is your masseter muscle, and I want you to know your sternoclenoid mastoid muscle and your semispinalis capitis muscle coming across there. This is your spinal cord there in the middle with your dens. And I want you to know your parotid gland. So take a look at the density of the parotid gland. As you can see, it's a different density than the muscle. So this is your masseter muscle right here, and this is your medial pterygoid. So you can see it's a different density. Here's the bone. So you can see it's a different density from the bone in addition. So pay attention to that to the gland because it does look different. So you have to be able to label that. It's your oral pharynx there with your soft palate posterior. So, myohyoid muscle, so here's your mandible right here. Your epiglottis is free floating there for you. Your submandibular gland, and this is your sternoclenoid mastoid muscle, and I'll show you how that works. It attaches to like your mastoid air cells and wraps around to your clavicle. So as we get lower, it's going to get more and more anterior. You have your trapezius muscle with your splenius capitis muscle, your semispinalis muscle. And you have your levator out here. Your vertebral artery is running right there, so when you see the body, we did the labeling last week, so here's your body, and you can see that your vertebral artery is running right through there. You have your internal jugular and your internal carotid artery also. So here's a CT, axial post-contrast. Here's your hyoid bone. This is your epiglottis, your oral pharynx, and this is your vallecula on either side. We have your external carotid artery, your internal carotid artery, and your internal jugular vein. Now you got to look to see where we're slicing so you'd be able to label that properly. Looking at a coronal MRI T1, here's your epiglottis. You have a retinoid cartilages here, so you have your cricoid cartilage that comes up with your retinoids, and then you have your thyroid cartilage that kind of comes into a V. So that's how it works. You have a cricoid coming up with your retinoids on the end, and then you have your thyroid cartilage there. You have a retinoid folds here. This is a CT post-contrast, as you can see here. It's pretty good though, coming down. When we're looking at your thyroid gland, right down here, you have your cricoid cartilage with your retinoids, and here's your thyroid. You can see it coming into the cricoid. So we have an infrahyoid muscle coming around. You have your retinoid folds right here on either side, and this is your laryngeal pharynx. We have your piriform sinus on either side, your left common carotid, your left internal jugular. Around the back we have your trapezius with your splenius capitis. I want you to know your semispinalis cervacis muscle there and your semispinalis capitis muscle. This is your sternoclenoid mastoid muscle coming across. See, it's more anterior as we get lower. So coming around here, this V-shaped is your thyroid cartilage. Here's your larynx, and you've got your piriform sinus on either side. This is a 3D view here. So you've got your hyoid bone. This is your epiglottis. This is kind of give you an idea where we're at. This is your thyroid cartilage. You have, I want you to know your retinoid cartilage here with your cricoid. And then you have tracheal rings that are tracheal cartilage. So you'll see those when we look at the images. You have true and false vocal cords also. So looking at an AP and a PA posterior view. So here's the epiglottis, and you have your coringulate cartilage on your retinoid cartilage. So these are little like horns on the ends, okay? So you can see these on CT and MRI. Here's your cricoid cartilage, and you have your thyroid gland with parathyroid on them. So we have trachea with your tracheal cartilage, so your tracheal rings there, and this is your thyroid cartilage on either side. This is your cricoid, and you've got what I want you to see, your thyroid cartilage, and you have your thyrohyoid ligament with your hyoid bone up top. So this is your Sag T1. You have your soft palate here, your epiglottis. Right there is your thyroid cartilage, or I'm sorry, your hyoid bone, and then this is your thyroid cartilage. These are your vocal cords. This is your cricoid cartilage right there with your trachea. See, your esophagus is collapsed. So you don't see it unless there's air or food particles within it. So the little epiglottis comes down, clink, protects your airway, and food goes down the esophagus. So hard palate, soft palate, epiglottis, esophagus collapse there. Your trachea, your larynx, your thyroid cartilage, and your hyoid bone. Remember how I said your hyoid bone is just going to be free suspended there within the tissues? That's it right there. All right, this is a proton density axial MRI. Infrahyoid muscle, we have your thyroid cartilage here and your cricoid cartilage in the back with your larynx. And sternoclenoid mastoid muscle is this one right here. Looking here, we have your thyroid cartilage, that's kind of the V. You have your epiglottis, you have your piriform sinus on either side with your larynx there in the middle. MRI T1, looking here, this is your mandible, so we're up pretty high. You got to look to see where we're slicing. You have your epiglottis, so this would be your soft palate right in here. Oh, nope, I lied. That's too low, so sorry about that. So looking here, this is your sternoclenoid mastoid muscle. You have your trapezius with your splenius capitis and your semispinalis muscle. And then you have your levator scapulae muscle there. And internal carotid with your internal jugular. Looking here, this is your mandible. You have your epiglottic valleculae here with your epiglottis right there, and this is your oral pharynx. Here's your sternoclenoid mastoid muscle. This is your internal jugular muscle there. This is your submandibular gland, so you can look and see where we're at to see that it's a submandibular. You have your thyroid gland with your vocal cords on the inside and your rima glottis in the middle. This is your external or internal jugular vein. Your thyroid cartilage is the V there. You have vocal cords just on the inside and your rima glottis and your retinoids. You can see them on both sides coming up. Your larynx with your thyroid gland. You have your cricoid cartilage, you can see here, going around, sternoclenoid mastoid muscle, anterior scalene, middle scalene, and you have your brachial plexus there. Here is your trapezius with your, which one is that? Oh, splenius capitis, sorry. And this is your levator. So here's your cricoid cartilage with your larynx. And this is just showing you the vocal cords adducted and abducted, so open and closed. And this is a picture of the vocal cords closed. This is the layout of how it all kind of fits together. Here's your cricoid cartilage with your esophageal sphincter coming down, and here's your trachea with your aortic arch, your carina there, your esophagus down into your stomach, so you have your diaphragm and your esophageal hiatus. Okay, so here we have your trachea, here's your thyroid, and your esophagus. You can see here is collapsed. It looks just like a muscle because it is. And here is the body of your C-spine. Okay, so here's your trachea again, and here's your esophagus. Look how big this internal jugular vein is. It's a little concerning. Okay, we're going to stop there and we're going to pick up from the next slide moving forward into the next section.